Do you have hard, tight, painful muscles that have developed over time or following an injury? Do you try to get massages and they sometimes make you feel better, but sometimes make you feel worse? Have you been prescribed muscle relaxers, but they don't really seem to help? You may have developed trigger points. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been helping patients with trigger points for over 20 years. Please remember, these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for treatment. These are strictly for informational and educational purposes only. The first video, we discussed what trigger points are. Second video discussed trigger points and headaches. The third video discussed whiplash and trigger points. And this fourth video is going to be discussing chiropractic care and self-care for the treatment and management of trigger points. So let's jump in. So how can chiropractic care help trigger points? One would think that if most of the pain is coming from the muscles, that working with the skeleton and working with the joints may not provide as much relief as massage. And there may be some truth to that knee-jerk reaction, but the reality is that the research shows that chiropractic care is really helpful for patients with myofascial pain and trigger points. In fact, there was a review study that was done in 2008 that looked at the role of chiropractic care and found it to be very beneficial. And the reason is that many trigger points develop secondarily to disruption somewhere in the body. So for example, let's say that you're a patient and you have developed what's called forward head carriage, where you're sitting there, you've developed postural strain, you're looking forward on the computer, and as the years go by, mechanically, your head is all the way forward compared to your upper body. You're going to develop what's called adverse mechanical tension across your back and shoulders and trapezius. So while your pain might be located within the muscles, that's secondary. Those muscles are acting as a check rein, trying to hold you up, trying to prevent you from falling forward because of your forward head posture. So until you go in there and correct the mechanics of the neck and the mechanics of the upper back, you'll never truly take that tension out of the trapezius and out of the neck. The human skeleton has all these little bumps on it, and these bumps are little areas where muscles get to attach. So by shifting and moving the mechanics around, you can take some of the tension out. However, something else happens. As these joints jam and lock mechanically, there are nerve endings inside these joints. These nerve endings have reciprocal connections that go to the stabilizing muscles in and around the locked, painful, restricted joint. Chiropractors have known for years that if you go and find areas of trigger points in and around the spine, it is oftentimes an indicator that there's underlying dysfunction or disruption of the joint biomechanics. Research has been done where they measure the electrical output of muscles in and around the spine, and then they give a chiropractic adjustment. They then go back in and measure the electrical output, and then the muscles relax. Now, if you've ever been a patient under chiropractic care, you do not need electrical studies to tell you that you feel relaxed even in your muscles following a chiropractic adjustment. So, one of the things that you can do for self-care is just don't look down at your phone for so long. I mean, we sometimes joke and we see some of these teenagers and these children walking around, but now we have the adults copying what our kids are doing, where we're spending all of our time looking down like that. So that is one of the most basic things that you can do. The other thing that ends up happening is you do need to treat the muscles. So in addition to massage, there can be something called ischemic compression. That's basically where you put pressure for about 30 seconds on tight muscles, and you will find that they will release. Muscle energy techniques. Some providers do those, some don't, but those are ones such as PIR, which stands for post-isometric relaxation. There's different things that you can do to try to release them that way. You can do it yourself, you can be trained how to do it, or you can have somebody do it to you. Massage. Even though we said that sometimes patients feel worse with massage, in the right situations where you're correcting the underlying joint biomechanics and the postural distortion that might be there, as long as that's happening, massage can be very appropriate, very therapeutic, and very beneficial. Last but not least, the other one is exercise. If you as an individual are sedentary, your muscles will just automatically shrivel and wither on the vine and shrink. And as they do that, they become stiff, tight, and weak. Exercise will start to lengthen them. You took time to get there, it'll take time to reverse it. So general exercise in the context of a treatment plan seems to be very beneficial. So to bring this full circle, massage is beneficial, but not in and of itself. Chiropractic care is very effective, but not only in and of itself. Usually there needs to be an assessment of the underlying joint biomechanics, the postural alignment of the entire skeleton, of the entire body. Tension started to be taken out of the joints, taken out of the entire skeleton, and then muscle work done either in the form of massage, exercise, or some of the other muscle energy techniques. And last but not least, the patients have a responsibility on their own to avoid doing what is harming them, watching the posture, watching that phone use, watching sitting in front of the computer, and then incorporating daily activity and daily exercise to condition the muscles. I hope you found this helpful. You have a lot of videos that you can watch, and I'm honored that you chose this one. So until we meet again, have a wonderful journey and be blessed.